Most people always tell me, I've never had a problem before. Why is my blood pressure up? How come it's up now all of a sudden? I've never had it before. I say, well, you never know. Things take a long time to build up in your body, and by the time your body is telling you the signs, it may have already been occurring for like 5 to 10 years before. If I were your doctor and you had high blood pressure is called silent killer for a reason. Most people don't feel it until it's dangerously high or it's dangerously low. And then they're shocked when they end up in the ER with a stroke or a heart attack. If you came into my office today with high blood pressure, here's exactly what I tell you and what I think of some of the TikTok sleep hacks that claim to lower it overnight. First of all, what does high blood pressure really mean? So blood pressure basically measures the force of blood pushing against the artery walls. Imagine knocking on the door versus pounding on the door. That top number is which we call a systolic, is when the heart squeezes or when the heart pumps the blood out. The bottom number, diastolic, is when it relaxes. Normal blood pressure is around 120/80. High blood pressure technically is usually 130/80 or higher. The danger, over the years, it can silently damage your heart, brain, kidneys, and eyes, to say the least. If you were sitting here as my patient, here's where I'd start. Number one, check your accuracy. Right? I have patients sit like this and sit like this and check your blood pressure. You want to sit straight, firm, arm at a heart level. You want to track your readings. Don't panic if even one of the numbers is high. Look at the pattern. Lifestyle is still very big. Obviously, you know how it is. Don't smoke, try to eat well, try to exercise. Now, of course, you know how I feel about medication. If you need medicine, then you take it, especially for blood pressure, because that's not something you want to wait around. Now, I've seen a lot of TikTok's sleep hacks claiming they can lower blood pressure overnight. Let's take a look at one together. Here's the truth. Quality sleep can lower blood pressure long term, but these hacks, some may help a little, like that cherry juice, which boosts metabolism. Others, like mouth taping, that can be risky, especially if you have sleep apnea. Always ask your doctor before trying this. So, what are some red flags with blood pressure? So when should you act fast? If your blood pressure is above 180/110 in the bottom number, if you have chest pain, shortness of breath, dizziness, vision changes, or severe headache, that's definitely an indication to go to the urgent care or the ER. And I get this question a lot. Doc, the top number is high and the bottom number is high. Who cares? As long as one is okay, the other is okay. It doesn't matter if only one is high. Which one is more important? They're both very important. The systolic, which is the top number, usually can occur for so many different reasons. Usually I explain blood pressure is kind of a faucet, right? For example, you have a pipe that's got water in it. Now, when I open that faucet, the water comes out. The pressure that water is coming out at is the top number, aka the systolic number. Now, let's say I turn the faucet off. Does the water just disappear and go away in thin air? No, there's still water in that pipe that's resting, and that is the bottom number, which is the diastolic. Both numbers are very important for just general health and, of course, heart health. The top number can vary for so many different reasons. If you had a big salty meal, if you didn't sleep well, if you're stressed, that top number can go up quite frequently. But let's say your top number is good, but that bottom number is high. That could be more of a strain directly on the heart, because why is your heart being strained at rest? That could mean that even at rest, your heart is not getting enough oxygen, which is then straining it. So for example, some people have something called pulmonary hypertension, sleep apnea. These can strain the heart, which then in turn can increase that lower number. You know how I feel about medicine. I'm always trying to take people off their medicine, trying to do things more natural. But there's few things in medicine, in the medical field, that I do treat when it comes to numbers. Blood pressure, cholesterol, diabetes. I always like to give my patients a chance to try themselves. But I'm not gonna wait like 2 years to see if they can improve their health in order for me to start blood pressure medication. The reality is, it's way better to control your blood pressure than to try on your own and see if you can bring it down. If you can, great, I'm all for it. But the reality is, if you need it, please take it. Because I'll put it this way, I can knock like this for my entire life, no problem. If I start banging and pounding on this, I'm gonna start to damage this desk and my hand. That is a problem, just like your blood pressure. You start to bang on the sides of the arteries on those walls, they start to get damaged, they start to get stiff, they can cause a lot of problems down the line. Most people always tell me, I've never had a problem before. Why is my blood pressure up? How come it's up now all of a sudden? I've never had it before. I say, well, you never know. Things take a long time to build up in your body, and by the time your body is telling you the signs, it may have already been occurring for like 5 to 10 years before. For me, it's very important for my patients to try and check their blood pressure when they can. Look, let's be honest, who wants homework, okay? I've done a lot of homework in my life, I've taken a lot of classes, done a lot of tests, now I get to give the homework. But this is the most important homework of your life. So when I tell patients to track their blood pressure, don't do it for me, but really do it for yourself. Because at the end of the day, it's your life and your health. I just want to help guide you as best as I can. But when it comes to checking blood pressure, remember, you're not gonna check it like this. You don't check it like this. You don't check it like this. You wanna sit up, square up, put your feet on the ground. Ideally left hand, it should be about heart level. You could also use the right hand. Sometimes there is a little bit of a difference between the blood pressures between the two hands. And then you want to take a couple deep breaths. And breathe out. And relax. Usually I tell patients to check 2 or 3 times in a row and then average those blood pressures to give you your final reading. For me, it's important to not go off just one number. That's why I ask my patients to do their homework, because trends are your friends. If you come into my office and that's the only time we check your blood pressure, what choice do I have but to treat the number at hand? But if you come into my office, you say, hey, look, I got my whole list of blood pressure readings right here, and they've been good at home, then I feel more comfortable knowing that it's controlled outside of this environment. To me, blood pressure is silent for a reason, and I get this all the time. I have a lot of patients. They have high blood pressure, they are on meds. Then I see them, I'm like, man, your blood pressure is high. You've been taking your meds? They say, no, I stopped. I feel fine. I don't need blood pressure medicine. I don't feel nothing. I don't feel anything. I'm okay. So that always drives me kind of crazy, because you should not feel your blood pressure to begin with. So when people tell me that, I say, why even brush your teeth then? Just wait until you feel the teeth decay and your gums get sore and you get swollen. Just wait. You don't feel it, so just wait till you do. Is that really what you want? I hope you said no, because you don't want to feel your blood pressure, and you definitely don't want to feel your teeth decay. Just like the reason we brush our teeth every day, what is the point? Stop brushing your teeth. Just wait. Just wait till it gets messed up. The whole point is to prevent it. My goal is to prevent your blood pressure from continuing to stay up and to help you protect your health. The reality is, blood pressure is tricky. It can literally change from like second to second. So that's why I say, check your blood pressure maybe once, maybe twice a day. Don't go crazy and start checking it every 2 hours. Technology has increased or improved. There's certain studies or certain gadgets in the works that apparently can track blood pressure through your wrist. To be quite frank, I don't know how I feel about that, especially because it's gonna fluctuate second to second. No matter what though, if you have high blood pressure, please take it seriously. That's not something you want to wait around and see what happens. Because like I always tell patients, you're good right now. I tell them all the time. You can eat like garbage, you can drink, you can smoke, you can do whatever you want, not exercise. No problem. Your body can handle absurd amounts of abuse. You can stress, you can worry, no problem. Live your life like this for 20 years, but then don't come back to me in 20 years and say, hey doc, How come I got chest pressure now? How come I can't walk much? How come my heart's not as good? I can't help you at that point. You gotta help yourself to some degree. You gotta do it now. And I mean that because I really am very big on the quality of life for all of my patients. And it's so crucial for you to try to look at the long term as well, right? They always say nothing is promised tomorrow. Tomorrow's not granted. Most likely we will survive and live to tomorrow. So we must prepare for the best tomorrow we can have. High blood pressure is silent, but it's not unbeatable. With the right steps and sometimes medication, you can control it and protect your heart. Don't rely on hacks alone. If you want more practical health advice without the panic, relax. I'll explain in the next video. Subscribe and drop a comment with your average blood pressure reading. I might show you just how to track it better in a future video.